Some healthcare workers, first on the list to get COVID-19 vaccines, are saying no thank you, or at least not right now. When you look at who is hesitant to get this vaccine, is it doctors, is it nurses, is it technicians? What types of employees?
When we've seen hesitancy, we haven't seen it among our frontline workers who have seen firsthand the effects of COVID. We are typically seeing it in younger individuals, particularly nurses, or those young women who are thinking about becoming pregnant or are currently pregnant.
Kentucky's health commissioner says sometimes more than 30% of people eligible are declining the vaccine. That figure, around 60% among staff at nursing homes in Ohio, according to Governor Mike DeWine.
We're not going to make them, but we just, wish that they had a higher compliance.
CVS Health, which is administering vaccines at nursing homes in 49 states, telling CNN, we're seeing more vaccine hesitancy among staff when compared with residents.
Do you know if it prevents illness with the other 4 human coronavirus strains?
At Vanderbilt University Medical Center, they're holding town halls like this one to answer workers' questions and combat misinformation about the vaccine.
There's so many things that are circulating that simply aren't true.
So when are you going to get yours?
On Tuesday, the Surgeon General told states that if demand among healthcare workers was low, to move on to other priority groups.
If healthcare workers don't want to get these vaccines in some places, and you saw in Ohio that 60% of nursing homes staff said they didn't want it, then we need to move on to the older than 75 group.
And Ohio's governor is pleading for those nursing home workers to change their minds.
I urge them, and I'll make this plea right now to anybody who works in a nursing home. You are there working very hard. You have a risk, but also the people in that nursing home have a risk. And this shot does work, and it is, in fact, very, very safe.